Hannah Lynch is the Associate Director of Federal Government Relations and Health Policy at the National Psoriasis Foundation, and she's also the co-chair of Safe Step Coalition. Hannah, I'm assuming she's here. I'm hoping she's here.
I am, Julie. Hey, how are you?
Good. Welcome to the dinner party. I guess that's what we're having, a sleepy dinner party. And so glad to have you present and share about another important aspect of sleep and policy.
Awesome. Well, I just want to say thank you all very much for asking me to participate today to share a little bit about the issue of step therapy and what the Federal Safe Step Coalition is doing in this area to really help patients and also providers with this issue. I am not going to be doing slides today, but I will be sharing information. I'm happy to keep a look on the chat also. So as soon as I finish talking, if I can put it the bill numbers or, answer any questions, happy to do so. Or can also share my email if anyone is interested in just following up about interest in the coalition or some of our activities after this. So I know I was looking through the attendees in the Zoom, and so I recognize several names here. I know some of you are very familiar with the issue of step therapy. As chronic disease communities, we're all advocating on behalf of our patients. And so a lot of times these issues don't only affect, obviously, the psoriasis community, but also you all in the sleep community as well. And step therapy is one of those that really affects a lot of different patient groups, especially those with chronic diseases. So step therapy itself is an insurance protocol that requires patients to try and fail treatments that are selected by the insurance company before granting coverage for the treatment originally prescribed by the patient's doctor. Usually the insurance company is making that decision because of cost. So we are obviously, as the emergence of biologics have really taken hold and they have really emerged as a top treatment for a lot of chronic diseases, we've seen this practice increase because biologic treatments normally tend to be some of the more expensive treatments out there. And so it's really not taking into account the medical history of the patient or listening to the provider about what is best for the patient as the person that really understands the patient's overall medical history as well. I was in a meeting with a dermatologist out of Texas who really put it in a great way. A talking point I've used that it's an algorithm used by the insurance company that doesn't take into account anything about the individual patient. And so that's not always the most effective thing or the most medically appropriate direction for patients. We do an annual survey of our advocates here at NPF. And in 2020, we found that among people with psoriatic disease taking biologic medications, 70% reported experiencing step therapy. So I'm sure that number is also very high in many of your communities as well. So there is a big effort to do a lot of things around step therapy legislation. I will say I will cover a lot of the federal aspect because that's what I co-lead with, but there's also a lot of patient groups that are very active at the state level as well. And so both, at the state level and also the federal level, these step therapy reform legislations do not ban the practice of step therapy. And so what they do instead is creates common sense guardrails that will ensure step therapy protocols are based on appropriate clinical guidelines, will create a clear and transparent process to request an exception to the step therapy protocol, outline the requirements for when a provider may request an exception to the step therapy protocol, and provide timelines for when an insurer or PBM must respond to a step therapy exception request. As I mentioned, there's a lot of pieces of legislation at the state level. Over 30 states now currently have some form of step therapy protections on their books. California is the most recent one. The governor recently signed that legislation into effect. And I know that the same coalition and some of those patient groups are active in New Jersey, Pennsylvania, and Massachusetts in this area. For us at the federal level, obviously, I always like to talk about the state piece a little bit because I think it's important to couple that with the federal piece. They're really two pieces of a puzzle. If you only are doing state legislation, that is applying to, folks that get insurance that is regulated by the state. And it's leaving out, obviously, there's a hole there. There's a chunk of folks that are in employer-sponsored plans or some other thing that is regulated by the federal government. And so that's why federal legislation is also needed to really make sure that everyone is afforded the chance to take advantage of these step therapy protections. So for us at the federal level, we have the Safe Step Act, and it has officially been reintroduced in both chambers in this new Congress. The numbers for this legislation are S464 and HR 2163. Again, I can type that in the chat after I get finished, just so you all have that as reference. This bill was first originally introduced in the House of Representatives in 2017. Representatives Ruiz and Winstrup, so the congressman of California and Ohio, who are both doctors, and the Doctors Caucus have introduced that and really have been integral parts of moving this legislation forward and been with us from the beginning. Then the counterpart in the Senate was introduced in 2019. So in the previous Congress, we've done a lot of great work about raising awareness about the practice of step therapy and getting attention brought to the issue. We ended last Congress with 157 House co-sponsors and 18 in the Senate. I will say already, since it's been reintroduced, we are back. I'm making sure to double check my numbers because they updated yesterday, but the House is back up to 103 co-sponsors, and the Senate, we have increased significantly. So we're at 28 Senate co-sponsors now. So I think that just goes to show that this issue really has remained kind of a top priority from folks. I'll say from a coalition standpoint, when we do meetings now on the Hill, if we bring up, are you familiar with the practice of step therapy? We almost always now get the response that, yes, another group has just recently come to us and brought this issue up. And so I think that just really shows not only how much the practice of step therapy affects groups, and they have raised it as an important issue for them, but also just that the understanding that education over the last few years has really worked, and most staffers on the Hill are familiar with this and have heard about it from several groups. And so we have done a lot of work inside the coalition to really try to identify areas. Unfortunately, at the federal government now, as you all are aware, things do not always move by themselves anymore. So we are always looking for opportunities to kind of identify a package or a route or somewhere where these protections can be included, because again, it is so important. We recently had drafted a letter and submitted it to leadership and also the committees of jurisdiction around reconciliation. Don't think that is going to happen, just given, as everyone knows, how much that process is not going so well. But again, we always are looking for those opportunities and want to make sure that we submit these letters and continue to raise awareness about, pushing this forward. We also have a group, that meets every other week, and there's a distribution list. So as a coalition, we like to share just updates for the group, opportunities for the sign-on letters, hold meetings with offices. I think we've done a great job about gathering co-sponsors, and the coalition has really been focused recently on gathering more committee support. So circling back to members of the Education and Labor Committee in the House and the Senate Help Committee to talk about where the bill stands, answer any questions that they may have, and try to gain a lot of support there. We currently have over 200 patient and provider groups that endorse this legislation, and there's a flyer that is circulating that we update on a regular basis, when we do outreach to these offices. So I think there's been a lot of progress made. We still have a ways to go. So I would, of course, like to plug on this call, if anyone has questions or wants to get involved with the coalition, you can always feel free to reach out to me. And if your groups are doing outreach to the Hill and this is an issue that you talk about, we would really appreciate it. If you have folks that are on either of those committees, connections there, and you can bring this up to them about bringing this up and moving it forward, we always appreciate that as well. So I will stop there and pass it back to Julie.